Can one idea change the way millions receive health care?
If we could have a better way, it would be great.
After graduating college, 3 young women founded a company to close the technology gap in healthcare.
We're designing products on the ground with these people.
What sort of problems do they have with the equipment they currently have?
So that's why we're down here, establishing those relationships and making sure that we have all the necessary feedback to improve on the devices and to get them to a final product.
We take you on the ground in Africa and in the United States to see these innovative ideas in action.
I'm Kim Clark.
And I'm Pat Werhane.
We go out into the world to look at everything.
Topics such as food deserts, wage theft, and recidivism in jails.
Access to healthcare, education, welfare, major issues we face at home and around the world today.
Come search with us for answers to these issues and more
as we discovered new answers to today's big questions.
The developing world has some unique medical challenges. There are blackouts, equipment shortages, and huge gaps in technology. And these problems can seriously affect the quality of care, with treatable illnesses suddenly becoming life-threatening. While many organizations and government programs try to fix these problems, it is still not enough. If charity and government programs aren't enough, what can we do? A new push toward custom-built devices and for-profit solutions may be the change these countries need. We met with Sisu Global Health, a company founded by 3 young women who hope to solve problems by working closely with doctors on the ground.
Largely, healthcare is funded by government, so there's a huge deficit because of poor government funding and inadequate government funding. So you have a facility that may not have a doctor, as well as may not have equipment and machinery to diagnose and probably look after patients.
Many doctors in Ghana deal with life-threatening complications during surgery. It is common to use a soup ladle and gauze to collect a patient's blood during surgery.
You have blood in the abdomen, you scoop it, and then you sieve it with just gauze. That is what we used in the past. And then put it in a situated bottle and then put it back on them.
The screening methods may have certain deficiencies that may, there's still a small chance that you may transmit an infection from one person to the other. But if it's the patient's own blood, then it's the best you can have.
If we could have a better way, it would be great.
As the economies of the developing world improve, long-standing issues like public health need to be addressed. Countries like Ghana need new ideas to save more lives, faster, cheaper, and better than ever before. It will take innovative companies like Sisu Global Health to solve these pressing issues by partnering with local governments, healthcare professionals, and patients.
For instance, if the head of the laboratory needs an associate professor.
Sisu Global Health is a medical device company that is developing and sourcing technologies that are meant for developing countries where they might experience a variety of challenges that aren't applicable in the US, such as lack of electricity and power, different emergency needs that we don't necessarily have in the US, different diseases that we might not have in the US as well, like malaria, HIV prevalence, and things like that.
We're designing products on the ground with these people who would actually be using them. So doctors, clinicians, even the maintenance staff, people who would purchase the product. All of these different people, all these stakeholders are involved in the design process to make products that are ready for the commercial market.
Look, I have seen the idea, I have looked at it, I have understood it, and I believe it's a very good product that can help a lot.
So the inspiration for these devices came out of my time at the University of Michigan.
It's a little bigger.
Okay.
And I realized that it went for probably a tumble.
So the first device that we've developed is a modular centrifuge. So this centrifuge can be used to process samples to do diagnostics.
3D printed.
Okay.
So it's going to be mainly plastic and some fasteners.
And this is critical for cross-matching, for determining if somebody has the same blood type for transfusion, for diagnostic tests, as well as blood transportation.
So this centrifuge can be used with electricity or manually powered. And this is mainly for places that might have some access to electricity, but not necessarily all the time. So this can go anywhere from a city hospital that has power outages all the way to a rural clinic where they have no access to electricity but need to process samples to do diagnostics.
You can plug it into the wall,
Okay.
you can attach it to a battery,
Okay.
or you can spin.
You can spin. Yeah, that's good. You have alternatives.
As we speak now, the light is off. We are running on generator, and if I have such a equipment in my facility, I really want to probably put too much pressure on the generator or have it on. I could run my tests using the equipment without the need of having to put the generator on. And it may be very useful in even in the towns and villages. At the moment, we have a huge deficit in power supply, so it may come in very handy, where it's very mobile as well, so you can move from village to village, and you could use it without having to rely on power supply from the source.
And so we go to each different hospital and show what sort of device, ask what sort of needs they have, what sort of problems do they have with the equipment they currently have, which is mostly from the US, Europe, and styled towards that sort of system with plenty of electricity, plenty of donor blood sources, plenty of other resources that you need to do a hospital in the US. Those actually might not be here, and in that case you have to have certain designs for areas that can kind of make up for those resources.
You need to make sure that you can get the diagnoses out. So right now this is just a prototype, and I would love for you to come up and touch it and play around with it and take it for a spin.
Yes.
Yes.
We do, because it's in the northern part of.
So we wanted to just create something and get that feedback and look at the market and kind of target different customer segments and then see which ones are going to be the first to bite and then create a product from that feedback to then immediately sell to them once we already have that relationship established.
You don't have to go that fast. You can go. You only have to go about every 2 seconds, one rotation. So you don't have to be very strong. You don't have to be very strong. You can just very casually go like this.
Connection to the end users.
Sunlight here.
Yes.
So that it should be possible to charge a battery or something like that.
Yes.
And just have it run there. In that way, it is easier to standardize the speed,
Yes.
which they are worried about.
So I'm going to have it so it's 3 components of electricity. So one, you can go to an outlet, so you can plug it in.
Yeah.
But the other one is you can either hook it up to connect it to a DC battery, or you can go to a solar panel, which also gives direct voltage.
So that's why we're down here, establishing those relationships and making sure that we have all the necessary feedback to improve on the devices and to get them to a final product with the collaboration of the people here.
Though they workshop the product in the field, the design and manufacturing takes place in the United States.
We're at the Geek Group in Grand Rapids. The Geek Group is a makerspace for anyone that wants to come and make really cool things. So they have a variety of tools for people to make anything from, woodworking projects to different electrical projects to different, even just science experiments that they want to do, or entrepreneurs and businesses like ours where we need these tools but don't want to or can't. We can't invest in them ourselves because they're too expensive. So they allow us the flexibility to use the tools on kind of a time basis and not have to worry about paying a big shop to be there all the time. Josh, so would you mind being on camera?
Sure. You can come with an idea in your head and you can walk out the back door with the product in your hand. And we have everything in that entire design process within this facility, including the product development experts that are here to help you and answer questions and guide you to the right answers.
The Sisu team shares an engineering workshop with other startups in their community.
There's a little bit of everything down here too.
Working with the Geek Group allows Sisu to use expensive equipment at a fraction of the cost.
So this is the machine shop. As you can see, there are a lot of different types of tools. Tools like these we would never be able to afford on our own as a small company of 3 people. But it allows me to do a lot of the technical work and work with a lot of people that have more experience than even myself in the machining industry and manufacturing industry.
Much of what Sisu does wouldn't have been possible 10 years ago. 3D printers, shared tools, and workspaces allow companies like Sisu to cut costs, collaborate, and innovate.
And so is the prototype basically done, or is there still more work to do on it?
There's still a little bit more work to do with manufacturers to make sure that we can actually mass produce this in some quantities that are going to be cost effective for our end users. But this is the main prototype. We have some testing left to do, obviously on the ground with these clinicians in the hospital, but this is the concept that we're going with. It's been very valuable. We don't machine the hemofuse at this point in its design process, but in terms of having someone that can come by while they're in the machine shop making their own things and comment on ours and really give advice when we're looking for it, it's been great and invaluable. This is designed specifically for places where they have limited budgets and access to blood is very limited and they don't have the donor supply that we have here in the US. So this will allow them to perform auto transfusion, where you actually take blood from a person and put it through this device and then directly into a blood bag to retransfuse.
So how's this better than what they're doing right now?
So what they're currently doing and what we've seen and what we've actually talked to people at the Geek Group about is the fact that they're currently doing the best they can with what looks like a soup ladle and a piece of gauze. And they scoop the blood, put it through that piece of gauze, and then retransfuse the patient that way because there is no donor blood. And donor blood that they do have has a risk of not being even tested properly. So that allows them to do auto transfusion, but this is a replacement for that scoop and sieve, soup ladle gauze procedure. There are different maker spaces around the country that are popping up. One unique thing about the Geek Group is that they are a nonprofit, and so they really strive to provide education and learning along with all the different access to tools and experience. So they actually blend that value as well. So they really get us as an organization with our mission and our vision as well. This is an exploded view of the device. So you can see all the different pieces kind of detached from each other. About 3 years of work, probably about at least anywhere from 10 hours a week to 80 hours a week. So we are now on our, I think, 5th or 6th version of the design from the initial concept. That was created in 2010, 2011.
So how quickly is this going to be available in the market, do you think?
So right now, our main needs are getting it tested with users in a clinical setting. So we're going to Zimbabwe and working with doctors there to look at the different sites and see if we can actually get some clinical units on the ground with them and using it on patients. And we're also talking to Ghana as well about going through their Food and Drug Authority and getting approval to do clinical trials with already a series of hospitals that we have signed up. So hopefully we're looking at 2016.
never been to the Noble House, so
It's easy to think that this is another instance where the developed world barges in to show the developing world how it's done. But if you look closely, that's not what's happening at all. From the beginning, Jillian, Kate, and Carolyn have worked with their future customers as partners to fill in a large gap in medical care.
We've been back for too long. I'm excited to go to the next trip. I want to spend as much time in country as possible, and we have some opportunities to go to some other countries, including Zimbabwe and Malawi in the next year, and I'm excited to see how our device can fit in there and how that can work, and see some different places and how their health systems work.
Because each partner brings something to the table, together they can disrupt the status quo.
The Hemofuse is basically ready to manufacture and go through those extended FDA testing in the US, and then in order to go through actual blood testing with people.
Hold on.
Okay.
The utility of the device is kind of also something we really look at. How easy or how recognizable would it be for a doctor to use, rather than making something extra complicated for some reason.
It's 900,000.
How do you calibrate the feed?
So that's one of the things we're asking. This is just a prototype. So we wanted to know, should we put a light? Should we put a number? How should we kind of arrange the different electronics on it? Because we're also going to add a motor so that if you have electricity, you could just plug it in, or you could connect it to a battery, or even today someone mentioned a solar cell.
Sisu is a for-profit company which was developed with a social mission. It's part of an emerging business model which seeks to address a social issue while maintaining a traditional for-profit structure.
So a social venture is a company that not only looks at a financial return, but also a social return. So for us, that's improving healthcare access and improving the lives of the people that we serve. So that would be the end users and the patients in these areas that we're targeting.
So we look to have a company that meets that double bottom line in terms of we are returning money to our investors as well as saving lives.
You do have the financial return for your shareholders that you need to keep in mind, but also the responsibility to meet your mission in terms of improving health in these areas. So it's kind of both of them are important stakeholders in our business.
But we've definitely gotten some different reactions when we tell people that we're doing a for-profit business rather than a non-profit venture. And I'm not sure if that's because we're women or because they just have never seen something like this as a social venture. But I think it's definitely kind of reflective of some goings-on that we believe in the US, actually.
We actually tried to go the nonprofit route, or at least I did with one of the companies I was working on. And really, for-profit is a much better model because we plan on selling a product. So because when people purchase something, they value it a lot more. They're more likely to actually use it in the way that it's supposed to. I mean, you look at a lot of case studies, the most common is the mosquito net example. Across sub-Saharan Africa, when they were donating mosquito nets, people use them for wedding dresses and fishing nets and other things. But when they actually started selling these mosquito nets, they were actually used as mosquito nets. And so translating that concept and idea more into the medical device space means that when we sell a product, they're going to make sure that it's maintained. They're going to make sure that it's used properly because it has value, that they've paid some of their limited resources into using it.
I think the challenge in getting the right equipment is having a good maintenance team on the ground. Because you need to get equipment that can be serviced when you have problems. And usually the challenge is most of the reps do not have a maintenance team in town. So when you have a problem, you need to call probably overseas, call somebody here who calls somebody overseas to troubleshoot. And that takes time and delays, and you probably want the equipment working.
There are a lot of organizations as well that have also come in and tried to donate to Ghana. Again, the problem is these are good intentions, but the people, these hospitals, whether these donations are being taken care of and they're going to the right use, I don't know.
There is a place for nonprofits in this sector, but You don't want to underwrite the market. To make sure that this is actually sustainable and that people can continue to use these, you need to make sure that not only can your end user pay for it, but continue to pay for it and then support your local wholesale distributor and actually bring up the health of the economy that way, more so than just giving it to them and then them not having a way to reliably get that supply.
What do they do once it breaks? There's not like a maintenance system really set up for a lot of these devices, especially donated equipment. And so you see a lot of issues where they'll get a piece of donated equipment and in 2 years it breaks down, and then what do? You just have this huge environmentally kind of dangerous piece of equipment that just ends up having to be dumped somewhere.
And for us to rely completely on donors, and if we don't have the donors to then give them the free equipment, then that's not a reliable system for them or for us.
You know, again, once these donations are made and these products are used and, you know, sort of vetted and approved, I would like to see the government then, you know, listen to these doctors and actually go out and procure so that everybody can enjoy them. But a lot of times, a company makes a donation, they leave, and that's it. And it also comes back to the maintenance culture. Once they make the donation and they leave, after about a year or two, these products are done because nobody's taking care of them.
They are doing a good job by coming to the country then and every now and then. But I will urge them to let this idea go into the right people. In other words, contact the right people at the ministry so that and they can sell this idea properly.
We have made contacts and are looking to expand into other areas, but we don't want to overreach ourselves immediately or too soon. Ghana is our first pilot market. It is robust in terms of its private sector and public sector. And it's kind of a leader in the region.
When we go to any sort of entrepreneurial conference or a meeting with different entrepreneurs, we're definitely kind of a novelty when we go to these different places, whatever country it is in, actually. And so when an investor is not used to seeing or may have some concerns about women, it can be very difficult.
We have a lot of comments. It's a mixed bag of either you're too young, you're not experienced, and there's people who are you know, impressed and excited about what we're doing as well, and we kind of get two sides of things. But it really was, the opportunity was there, the timing was right. We had these two products we'd been developing to really go at it with our whole hearts, essentially.
Because they're looking at the entrepreneur and what they're familiar with and seeing how a person can do that. Additionally, we are younger, so that there is kind of maybe some hesitance, but we do have significant amounts of backing from some very high places in Ghana, as well as in the US, from various organizations with USAID and UN to different medical suppliers, including one that does autotransfusion in the US.
We've designed our products to make sure that we can sell them to the government or to these local clinics and actually make a profit that will allow us to then source that revenue into additional development.
This safeguards Sisu from several vulnerabilities, as Sisu does not rely exclusively on donors to sustain the business financially.
So we're doing this by sourcing needs from the end users, as well as looking at applicable technologies in the US that might be needed here in Ghana, for example, like sterilization, and also you know, emergency diagnostics.
Once we graduated from college, we had all the networks and the contacts and the idea all set up, and nothing tying us down. So we were able to jump in feet first and continue to live on ramen noodles and macaroni and cheese like we're well experienced as college students, and continue doing that as startup people.
I would love to see the devices in use. That would be the success for me. I would want to see them all throughout Ghana. That's really what I want to happen. I want to see it in use.
When you are selling a product, that means you can affect more than one village, you can actually scale to something that can be across a country, across the globe even.
How do you build anything? It starts with talking to people, and we're talking to distributors. You talk to, who would be your buyers like any other business, and then see how your devices can fit in that sort of set. Make lots of trips to Ghana, and yeah, I don't know, you just start talking to people.
It was like, why not at least try this for now? This is what I actually want to be doing, and I don't want to be interviewing with any more of these companies that I have no interest in working for.
Margaret Mead once said, "Never doubt that a thoughtful group of committed citizens can change the world. Indeed, it's the only thing that ever has."